Hello and welcome to VistaTalks, interesting discussions with interesting people from all around the world. Today I'm joined by Professor Martin Curley. It's a pleasure to have him on VistaTalks today. Very well known in the healthcare, digital health sphere. He's a professor at Maynooth University and has held very senior roles as well in his career at companies that we all know like Philips and GE and Mastercard and Intel, and also the health service executive, the HSE in Ireland, as a CIO. And he's also been the CEO of eHealth Ireland, in addition to being the digital director for transformation at Open Innovation. So Martin has a lot of expertise when it comes to all things health related. He's got some great views, and I want to really get into a great discussion today about the impact that technology is having on the changes to health, e-health, and also when it comes to international learnings and how we knit together this global requirement that we all have for healthcare, life sciences, and business. So, Martin, you're very welcome to the show. It's great to see you.
Thanks, Simon, and likewise, great to be back with you.
Well, we've gone through quite a few things there. It's a lot to keep up with. So would you maybe just want to take a minute and just give people a little bit of background or context to kind of what you're involved in today and what's keeping you busy?
Well, wonderful. Well, Simon, look, I've had the privilege of having some really interesting jobs and working for some great companies and to studied at some great universities, and that has given me some insights and tools and strategies. And I really believe we have the opportunity to transform healthcare globally. And I previously taught, I had the privilege to chair the EU Open Innovation Strategy Policy Group while I was VP and head of Intel Labs Europe. And out of that came a methodology called Open Innovation 2.0. And this is a book that he talks about a methodology for transforming industry using digital technology. And I guess I'm talking about actually a few things, what, how, when, and why. So why would we transform global healthcare? Well, next week we're hosting the UN Digital Health Symposium, and we're bringing the 150 top people in tech, in health, and in pharma into New York for 3 days. That'll be at Northwell Health and Fordham University. It's modeled on the Solvay conference of 1911 originally. And what we're creating is an intellectual super collider to actually bring a lot of the change agents, both the thought leaders, but the practice leaders together. And I really believe we're going to have the critical mass of people that actually could drive a global change in healthcare. And a couple of things I want to talk about. We're really privileged. Our opening keynote speaker next week is Professor Oded Galor of Brown University. He's written, what I consider one of the most important books in the last 100 years called The Journey of Humanity. And to sum that up in two sentences is humans have existed for 300,000 years on our planet, but something remarkable happened 2 years ago or 2 centuries ago. An average life expectancy went from just under 30 years to more than doubling. And we had this massive explosion in wealth. And why did that happen? And what were the drivers? Education was a key piece. There was, geographic factors. So what we're going to work on next week in New York is driving a metamorphosis of global health systems. So we've done remarkably well on public health interventions, discovery of penicillin, the discovery of new surgical procedures have added all of this increased life expectancy and better quality of life. But what we're seeing is that the health systems that have got us there are breaking down and they're no longer going to be sustainable. And we have, for example, Sir Keir Starmer, the British PM, talking about it's innovate or die or transform or die for the NHS. And interestingly, he's using the language that I've been talking about and others in terms of shift from analog to digital, from illness to wellness, from from hospital to home. So we know health systems are breaking. The NHS is in trouble. The US is in trouble. Here in Ireland, we have we've got great clinicians, but the system is really unsustainable. But we believe that metamorphosis can be possible, and so that's kind of the why. We're all living longer, we're all living better, but the system is falling apart and it's unsustainable. So the what is, we call this stay left, shift left, 10x, and we proposed the strategy that had its humble origins actually in software engineering based on if you find a bug during the design phase, maybe it costs $80 to fix, but if it's deployed in the field, it could be 8,000 or it could be 80,000. So it's all about early detection, and stay left, shift left 10x is a strategy. And healthcare is really complex, and we're really trying to introduce a new simple algebra for healthcare transformation and asking innovators around the world to work in the same direction. So stay left is about keeping well people well, or if you happen to have a chronic condition or need rehab, we can do that best of all from home. And we saw that, for example, in Ireland during COVID when people couldn't get physiotherapy in their hospital using a company called Salasso, who are based in Killarney in County Kerry. Thousands and thousands of people were able to have their physio at home, and that was great for them. They got equivalent care, but they had better quality of life, much better experience. From a sustainability standpoint, it saved money. So that's stay left. Shift left is getting you home as quickly as possible from the hospital to your home. And then what's probably most important is the notion of 10x, that we can do things 10x better, 10x cheaper, 10x faster. And when I was at Intel in 2012, I started to talk about a new Moore's Law for healthcare. And I had the privilege of working with Gordon Moore, and I had the opportunity, the first time I ever attended the Intel Extended ESM meeting, Gordon Moore sat down and we had lunch together. But Moore's Law is something really interesting because it's not a physical law. It's actually an empirical observation and then a competitive challenge for the industry. So Gordon Moore just had four data points that he talks about. He made this wild extrapolation to say, okay, we're going to be able to double the number of transistors every 18 months or 2 years, and we'll do it at more or less the same cost. Turned out to be incredibly true. What I've been observing, and since 2012, I think we have to be able to find a Moore's law for healthcare. And I was kind of a little bit uncomfortable at this initially, as was Gordon Moore, but several people, including Charlie Larkin at Bath and Insights Care, have started to call this Curley's Law. We have to call it something, so why not call it Curley's Law? But similar to Moore's Law, we both have an empirical observation and we also have a competitive challenge that we're setting for the global healthcare industry in the innovation that I've been doing and then the research. I'm observing this remarkable pattern. When we apply digital data to healthcare, we're seeing not just one 10x benefit, but 10x better, 10x cheaper, 10x faster, and 10x earlier. And at the Digital Health Symposium next week, I'll be presenting this empirical data. So Gordon Moore had just four empirical data points. I'll have 40. And that is the empirical observation piece. But the much more important piece is setting the competitive challenge so that everybody in the ecosystem works together to make this come true so that we can define, design, and deliver for this new law. And that's what's happened in the semiconductor industry for over 50 years. Everybody committed to this competitive challenge, and that, Moore's Law has been the driver of such amazing economic growth. And we believe, and we increasingly have a whole community of leaders like Dr. John Sheehan from BlackRock Health, or Will Jensen, who's the CEO of the New Zealand Digital Health Association, Matt Malarkey, professor in the University of South Florida, and Richard Jones, who's president of C2AI, that if we focus on stay left, shift left, 10x, we can actually not only meet this challenge with a nonlinear approach, but we can start to add increased years of quality life expectancy to people around the world. And I'm going on a little bit here, Simon. I'll just finish with one thing. 10 years ago was something called the triple aim, then it became the quadruple aim, but we now talk about the quintuple aim. And what we're observing is that when we apply digital and data to healthcare problems, we're able to see improved or equivalent care, lower cost or higher value, better quality of life, both for the patients and conditions, better experience, and very importantly, sustainability. The NHS, for example, is the biggest contributor to carbon footprint in the UK. It's also the biggest plastics pollutant in Europe. Um, but by applying digital and data, to give you two examples, just simple telehealth, and we've done a lot of work in Ireland with Reds Inc., and they've a nice paper showing the amount of savings per average car journey, and that's wonderful. And for example, in Galway University Hospital with Dr. Michael Malley, cystic fibrosis patients in the past, for every 5 physical visits they used to do, they now have 4 virtual visits. It's great for them because they actually save on average €900 worth of money. They also are convenient at home, and they're actually not exposed to any of the nasty hospital bugs. And then company in Northern Ireland, the fantastic Dr. Roisin Malloy, her Trimedica non-contact thermometer, it eliminates all of the plastic waste from taking temperatures. So that's a 10x sustainability benefit. It's also 5x faster than for a nurse reading the temperature of a patient. So these are examples of um, how we can get these 10x benefits. And just to give you a little bit of the theoretical underpinning, Edward Shortcliffe wrote a brilliant paper, 20 years ago, and he talked about that medicine is fundamentally an information management discipline. And if you can bring this exponentially changing digital and data capability to medicine, you can get these exponential transformations. And that's kind of backed up by Peter Diamandis, founder of the X Prize, who says, when you digitize something, it starts to perform like an exponential technology. So what we've been observing, and I'll be presenting this in the paper next week in the UN Digital Health Symposium, is both a theoretical basis for why we might expect these 10x benefits, some real empirical evidence from real projects, and then setting this competitive challenge for the industry. And this is actually so important because it could save our lives, our children's lives, our relatives' lives, or extend them. And it's all entirely doable.
It's incredible just to hear you speak about some of those initiatives and thoughts and the 10x and 5x, for example. I love the term a new Moore's law for healthcare, and the fact that you were looking at that many, many years ago is phenomenal. And the UN Digital Health Symposium that's taking place in New York, you mentioned, was it about 150 minds coming together? And I love the term. Was it intellectual super collider?
Exactly, yeah.
Phenomenal
And
term. Love that.
yeah, it actually comes. I had the privilege of being a fellow at the CERN, where
Yeah.
we had, where the LHC Super Collider is. But I've had the privilege also working with Professor Pierre Formica. We've written a couple of books, and that's kind of a term we coined together, and I think it works really well. And what we're bringing in is a lot of high capability, high trust people, and we're actually bombarding ideas. It's mostly TED Talks. We have some keynotes and leader panels, and then we're going to synthesize all of that into an output. And just to give you an example, we recently hosted the second International Digital Health Summer School at Maynooth, and we brought 120 people together. We had kind of smaller scale intellectual super collider, which was also a teaching experience, but out of that came the Maynooth Manifesto, which we might talk about in a few minutes. But just the whole idea, the original Solvay conference was held in 1911 in the Metropole Hotel, and I've stayed there a couple of times. Lovely hotel. I don't think it actually survived COVID. But the idea of bringing great people together to work on the big scientific problems of the day, that resonated with me. Now, unfortunately, in the original meeting, there was only one woman, Marie Curie, but this time we'll have equivalent, we'll have an equal mix, actually, probably more females than males. But it's invite only and also apply. And we're delighted we were four 4x oversubscribed. We had almost 450 people apply to come. We now have 150 people coming, and these are people from very large pharma, we and tech. We've got Dell and Alexion, but we have senior people from the WHO, from the WF, from UNICEF, but particularly from hospitals. And we're hosting 2 days at Northwell Health. Northwell Health are the biggest health provider in New York. They're also the biggest employer in New York State. And then we have a day at Fordham University at the amazing Lincoln Center. The first 2 days is really about stay left, shift left, 10x, and how we operationalize that, how we accelerate it. And then the third day is actually really focused on AI and healthcare. What are the advances? What are the regulatory and data protection issues? And so on. So we think we're going to have an amazing 3 days. We'll have a lot of fun. It'll be really intense. But I think we're hoping to move the dial seriously forward in this digital transition for healthcare. And I've really been inspired by Ilya Prigogine. He was a Nobel Prize winner. And there's an emerging field of systems innovation. And Ilya Prigogine once said, when a system is very far from equilibrium, small islands of cohesion have the ability to transform the whole system. And we believe that a metamorphosis is possible. So this shift from analog to digital, from illness to wellness, and from hospital to home is entirely possible. And we just have to decide to do it. And we'll be thinking about what are the organizational forms that can make this happen. Like we'll have the WHO there, fantastic organization. It's an organization designed for stability and consensus agreement and incrementalism. And what we're thinking about in incubating, maybe we need a sister association, much smaller, that's complementary, that's focusing on radical innovation and leapfrog. And so we're looking at all sorts of and culture, of course, is incredibly important. We'll have a fantastic fireside chat between Rill Jensen, one of my co-chairs, and Professor Katia Passerini, who's the provost at Seton Hall University. She's an information systems professor, and we'll be talking about what culture is going to be needed to make this great leap forward for our health systems.
It's incredible. I mean, it is a stunning lineup, and the inputs, the thought, the planning that goes into something like this is no small undertaking. It's incredibly exciting in terms of what you're involved in here. And this symposium that's taking place, the inputs are really impressive. But the outputs from that are going to be stunning, I'm assuming, because there's some great people coming together for this, man.
Yeah, I think so. And this is very much not about sort of a talking shop. It's really about doing. And in fact, our opening TED Talk is from a very good friend of mine now, Matt Malarkey. He's a professor at the University of South Florida in Tampa. And the title of his talk is Design Doing. So all the hype has been around design thinking, and that's really important. But Matt is talking about design doing, and he'll be opening for us. And then we have Dr. Peter Chang, who is a senior VP and the director of transformation at Tampa General Hospital. I had the privilege to visit Peter at Tampa General with Matt last year, and he's going to be talking about how he built a really impressive hospital at home program in Tampa General. And for those of people that don't know, Tampa General is has the the ambition to be the powerhouse of the southern states in the US, the equivalent of Mass General, with leaders like Peter behind John Curtis, the CEO. They're making really bold steps, and Peter's going to talk about how he used this design doing approach to actually build the whole hospital at home program. And when I was there, he's also built something like called CareCom, which is kind of like Cape Canaveral for the hospital, and the most amazing dashboard, looking at all the operations and being able to optimize in real time. But Pete will talk about how he used the design doing approach, how he did a crawl, walk, run, because they just started with 5 patients in the virtual ward. Um, but the research paradigm that we use, we kind of, without getting boring your audience, we use Open Innovation 2.0 as our innovation paradigm, and that's all about results. And we use design science research as the research methodology. And that's all about 2 things. It's about solving problems and utility, and then making contributions to the academic literature. But, probably the core output of design science research is what we call design patterns. Design patterns are generally reusable solutions to commonly recurring problems. So as we move on this journey, the key output from this symposium and our ongoing work, and we call this a directed open collaborative ecosystem, are design patterns. So, for example, we'll have the Secretary of Health of the part of Nepal. We'll have 2 of the vice chancellors of the top universities there, and we're hoping they will certainly contribute. They have a leapfrog opportunity, but they can take some of the design patterns coming out and apply it in Nepal. So Nepal can actually leapfrog. And, we've been working in Ireland to create a leapfrog strategy. And that was inspired some conversations I had with Roche, and then independently and together, Matt Malarkey, he's pointed out that if you just, the amount of effort you expend and the amount of capital to expand to do a follow me or just do incremental innovation is about the same to do a leapfrog. So why wouldn't you do a leapfrog? So what we will be all about is creating these leapfrog design patterns so health systems can explicitly decide, let's go to the next generation right now. And we believe we can do it at far less cost. And to give you one of the examples, one of the most exciting panels is our panel on open source electronic health records. And we'll have Stephen Nielsen, who's community lead developer for OpenEMR. We'll have Maxine Radcliffe, who's a service director in the HSE. We'll have Pete Boyd, who's CEO of OpenPlan IT, and Professor Anthony Staines from DCU, talking about actually why it might make sense to use open source electronic health records from a price perspective. Stephen's going to present evidence of 10x cheaper. He'll be talking about 10x faster, and Maxine will be talking about 10x more efficiency and effectiveness. Maxine has been the lead user for a solution that we've deployed in Ireland with the HSE, and almost despite the HSE, where 20,000 users with really complex needs are supported by just a clinical team of 50 people in 7 fixed sites and 150 distributed sites. Without the use of digital, that would be nearly impossible. You would need, for 20,000, you're up at 400 or 500 clinicians to do that. And she's, Maxine, she's the service director for HSE Social Inclusion. She's doing that for 10x less resources and probably more effectively, because for every patient they see in HSE Social Inclusion, they have their full electronic health records, they have their real-time prescriptions, and they can compare in real time. They can have, normally in hospitals, you have weekly MDTs. Now, Maxine and her team, they can convene a multidisciplinary team meeting in real time to deal with an emerging situation or with a particular patient who has needs. So Um, so to come to the outputs, just to summarize, it's design patterns, it's leading exemplars of how to do digital health and particularly health better. And if you think about, Simon, how the Bass diffusion equation talks about how particularly consumer innovations are diffused and adopted, and there's novelty, and then there's peer word of mouth. And by far, the most important thing is not the novelty, it's the peer word. So I tell Simon, hey, Simon, you need to take a look at this. It's doing this for me. And Simon, you tell your pal. So seeing is believing. So we'll be showing a lot of leading edge stuff in New York that's not pie in the sky. We'll be showing some really blue sky stuff, but 80% of what we're showing is actually real. It's being used with patients and by clinicians giving 10x benefits.
It's incredible just to hear you talk, Martin, in terms of the benefits that that's having, that leapfrog, that leveling up, that forward momentum that it's enabling people to do, and to be able to showcase that not in a somewhat theoretical sense, but in a real world environment sense, that this is happening, and to have those tangible results that you can share. It's extremely exciting. And I love what you said about moving from design thinking to design doing. It reminded me a little bit of the parallel with AI, and obviously artificial intelligence playing its own role in healthcare to some degree. But there needs to be a shift there too, maybe, if I can be so bold to offer, from AI hype and thinking to AI doing, meaning how is it making a difference? What is the bottom line? Now, look, you're a professor at Maynooth University. I know you're a visiting professor at the University of Bath as well. But you mentioned something I want to come back to if I can. You started talking about the Maynooth Manifesto. So can you tell us a little bit more about that, how that works, how that comes together, and how that sort of feeds into what we're talking about here today?
Yeah, no, thanks, Simon, for bringing that up. And the Maynooth Manifesto is very much, it was a synthesis of everything we learned at our International Digital Health Summer School, which was, super collider. And we're just bang, 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 and a lot of synaptic firing going on. And we've condensed this manifesto, which is in the short term, specifically targeted at Ireland, but it's a design pattern. It can be then copied and used elsewhere. And I've been really privileged to I'm sort of a member of the Society of Leadership Fellows at St. George's House at Windsor Castle. And last year I participated in a 2-day think tank on an NHS radical rethink. And this year I'm privileged now to be part of the organizing team for that. And we've been already discussing, so using the Maynooth Manifesto as a template for a similar output for our recommendation for the NHS. But just to give you a little bit of detail, we have 10 um, key principles for that. The first is digital or data, medical data or digital health as a right for patients. For too long, patients have been kept in the dark, and it's always been doctors know best, but in the future it's going to be patients know best. The second principle is around a leapfrog. Ireland is so far behind. We've had 20 years of missed delivery, despite our strategy being um, to have EHRs in our acute hospitals. And despite, probably being the highest GDP per capita in the EU and the OECD, we're last in Europe. And that's coming data from the European Commission, it's coming from IQVIA, it's coming from the OECD. And we're saying Ireland has to leapfrog to a new kind of digital health system where it's focused on the patient, it's mobile, it's cloud, and we have set the target and we're actually delivering it open source because two of the biggest electronic health record companies that have the biggest market share, their technology is very old. One of them is based on mumps, which originated in 1966 in Massachusetts General Hospital. That mumps was renamed M. The other one is kind of an actually one of my colleagues, Ray O'Sullivan, he's a gynecologist in Ireland. He called it a pimped up hotel reservation system or billing system. And he's been talking about how difficult it is for clinicians and burnout. So there's an opportunity to create a whole new kind of healthcare electronic health record based on what the clinicians, and I want to introduce just conveniently on my desktop, a fabulous book called Democratizing Innovation by Eric von Hippel. And Eric and I, we've never met, but we've independently been writing about open collaborative ecosystems for more than a decade. But Eric's book is more than a decade old, but he talks about the best type of innovation that can happen is when you have a lead user generate the innovation. And in Open Innovation 2.0, we've talked about this. We call it the reverse innovation pyramid. And so rather than the producers, a large company like Philips or GE or Siemens create the innovation is created by the user that has the challenges, has the need, and digital is really democratizing digital innovation. So I mentioned Maxine Radcliffe, and she's a fantastic example of a lead user. So as a clinician, she was an NHS nurse, leader for NHS Homeless Services in London, came to Ireland and said, "Oh my God, no electronic health records. We're going to develop it." So she's been on a journey with Open Plan IT, and Pete Boyd is the CEO. They're based in Brighton. They've actually built a healthcare system that meets the needs, is very agile. And people are saying this is not just 10x better than what they had before, 10x better than paper, it's 100x better. So, what we're advocating in the Maynooth Manifesto, specifically for Ireland, is also not just the adoption of this leapfrog system, but the adoption of an open source based digital health platform. And there recently was a new digital health strategy for the country. It's the third one. It's good. We support it. But the latest implementation roadmap from the HSE says the first EHR, other than the Children's Hospital, is going to be delivered in 5 years' time. We're advocating, we think we can deliver research, develop, and deploy a full national digital health platform in about 2 years, just over 2 years. So that's a part of the manifesto. And then there's a piece around life-saving data. Clinicians do not have all the data available. In some cases, not having the right information actually can lead to people's deaths. We're talking about 10x better solutions. We're talking about moving beyond illness to welfare. The entire business model of the global healthcare industry is built on the rule of rescue. And that's really noble. You wait till people are really sick, you bring them to the most expensive place for care, and you fix them. It's hero stuff. But what we need to do is shift at the early detection. And this is what Stay Left is all about, and using the parallels from software engineering. One of the best pieces I've read is from a cardiologist at Temple University, Kevin John Williams, and he's talked about moving away from too much, too late paradigm for cardiovascular disease. Cardiovascular disease is the number one killer, maybe 15.5% of deaths. But now we wait for late stage atherosclerosis. So atherosclerosis or arterial stiffening is the cause of that. And sometimes actually that's fatal. Other times you actually catch it. Somebody has a heart attack, and through an angioplasty, we're able to fix that. But what Kevin John Williams talks about, and it's a brilliant example of stay left, shift left, 10x, we actually know for more than a decade how to actually not only stop but reverse atherosclerosis through low doses of statins. And right now, what happens is you get to late stage, arteriosclerosis, and that's manifested by blockage in the coronary architecture or artery. So you got to unblock it, or you need to have bypass surgery, and then you load people up with very high dosage of blood platelet blockers, of statins. But we can avoid all that. by just detecting this early and treating it with low doses of statins. And that's, if we could only do one thing in stay left, shift left 10x, we actually could eradicate heart attack. Heart attack, I believe in 10 years, nobody should have a heart attack. And if I, give one other example, we work with John Martin, who's the chief medical officer of Butterfly. And John has been running a program in the northeast of the US where by using their portable butterfly scanner, it's called a POCUS, point of care ultrasound, and it's another 10x technology. It's 10x cheaper, it's 10x faster, 10x better. But by scanning the carotid artery in somebody's neck in 30 seconds, you can see if there's arterial stiffening. And that is, if you see that, it's likely that there is atherosclerosis going on in your heart. And what they found in a very large study, tens and tens of thousands of people in the US Northeast, I think 47, 48% of the patients actually had some form of atherosclerosis, and that was then able to be addressed and fixed, and potentially lots and lots of lives were saved by. So just using these kind of technologies, we can move from this rule of rescue to the rule of prevention.
Thank you for sharing that, Martin. It's such an important point that you share there, and also thank you for expanding on the Maynooth Manifesto as well. I just want to maybe ask you a quick question if I can, because as you were talking there, you made a comment about, you know, doctors and people, and I just want to maybe ask you a little bit about in this new era of healthcare that we are rapidly moving into. Hopefully, people, we are more diverse. There's lots of languages, there's lots of cultures, there's lots of information that needs to be shared. There's lots of statistics. You talked about digital health records. There's people from, very different geographies around the world that need to talk to each other and communicate in a health setting environment. There's a lot going on there. Do you see this 10x playing a big part in that when it comes to the human side of how patients benefit from that?
Yeah, very much so on many different levels, Simon. And a couple of examples. Yeah, how I don't want to get too theoretical here. 10 or 11 years ago with Pierre Formica and Thomas Anderson, I published a book called Knowledge Driven Entrepreneurship. And in that we talked about three laws of knowledge and knowledge dynamics, so the equivalent of kind of, the thermodynamic laws for knowledge. But ultimately, what's going to happen, we've moved from an era where it was about mastery of physical athletes to intellectual athletes. But if we think about that in healthcare, this might be a little bit of extreme, but I think when you go to a clinician, and particularly you're in an acute situation, it's a little bit like Russian roulette. It really depends on the clinician you have, their knowledge, their experience, what they faced before, and the diagnostics that are available to them. So a clinician, I saw an estimate somewhere that said clinicians only have 17% of the data that they could have potentially available to make that decision. But now fast forward to now where using AI and where knowledge is going to be commoditized, and that's a really profound statement. But every clinician, and Hervey Castro, he's a doctor in Texas, he talks about AI as augmented intelligence. But wouldn't you want when you go to your doctor or your advanced nurse practitioner that instantaneously they have access to all of the world's knowledge on healthcare, and in real time, the doctor, assisted by an AI assistant, can assimilate the information that the patient is providing, can look at the patient's history, can look at the whole history of medicine in the world, and in real time can start proactively suggesting diagnosis and treatments. And this is already possible. If I can give you an example here in Ireland, Adi Stack is a wonder. She's a pharmacist. She's CEO of Stack Pharmacies, but she's also CEO of DigiCare. and she's put a digital pharmacy system into the Royal Hospital in Donnybrook. And the first thing is she's done it 10x faster because normally implementations like this take a year. She's done it in a month. But what they've seen is a 10x, immediate 10x reduction in prescribing errors. Um, but what has been really helpful, there are several kinds of hospital pneumonia. And what we know is the treatments are quite specific. And if you prescribe the wrong antibiotic for the particular pneumonia, you get the wrong outcome, and in some case that's a fatality. So what AD's system, it's called her company, it's called DigiCare. It's not a full AI system, but it's an expert system. And it's detecting this, hospital-acquired pneumonia. Well, this is the recommended um, you know, antibiotic for that. And you're not relying on the doctor's memory to do this. And there's lots of evidence that the wrong antibiotics get prescribed. So that's an example of kind of an early eye system. But what's going to be possible, and if you look at products called Nabla, Nabla is a really good product. I've been using that. I actually use it when I'm teaching, and we do a role play with the class. We simulate a GP patient collaboration, and Nabla is collecting in real time the dialogue, and at the end it produces actually a pro forma doctor's note. It produces a note for the patient, and is at the point where it's suggesting diagnosis. This means you get actually 10x better diagnosis, 10x better summaries. Lots of research is showing like patients forget most of what is said, and particularly where there is a difficult diagnosis, lots of complex information um, is being uh, shared. And where you have a tool like Nabla, which is recording everything, it's synthesizing it, and then it's created by the doctor. And it's important that doctors do look at the information that is shared with the patients. They need to make sure it's at the right level, and they have to be honest, of course, but there is some work they need to do on that. So this is coming really fast, but it can change there's no question it can save lives, it can extend lives, and this is kind of a corollary of this new Moore's law, or Curley's law. We'll not just get the 10x benefits, but we can start to reliably add, say, 2.5 years of healthy life every 5 years as these tools get more and more deployed. And next week in New York, we'll have Echo Health um, presenting their digital stethoscope. And by using AI and listening to um, a person's breathing, they can create this electrophoniocardiogram, and they can detect valvular issues in a patient's heart that in the past would have required an echocardiogram to test. Sometimes in Ireland, you have to wait 18 months for an echo test. So now, if this technology will become commonplace, a doctor in his GP, by using this AI-powered digital stethoscope, can diagnose something that it might have waited 18 months or 12 months. And unfortunately, we know um, that 20% of people on waiting lists will actually die from a heart failure condition before they actually may get seen to. So this is 10x earlier, 10x faster, and the sooner we know about the issues, life-saving interventions can be made, or quality of life interventions can be made. So this is all possible. So there's no time to lose. Genuinely making stay left, shift left 10x a reality is going to save lives. Could be your life, it could be my life, it could be our families, our friends. So it's very important we do this as quickly as possible.
It's fascinating, Martin. And, on one hand, people watching or listening to this might think this is some far out scientific theory, but the reality is people are using this technology today. And I'm just thinking about family units and trying to communicate what was said with a medical professional, a doctor, a consultant, having the world's knowledge at your fingertips, being able to transcribe that into various languages for various family members, etc. It is an incredible power that we have. And as you say, when you look at it from a 10x perspective, it has a tremendous benefit on the quality of life for patients. So thank you for sharing that insight. It's profound. Um, I can't let you go though, Martin, without saying congratulations. And I want to congratulate you because I know you picked up an award recently. I saw you on stage collecting the award for being the digital transformation leader. And that's an important award at the Digital Transformation 2024 Awards. So congratulations on that. And I know you do an awful lot in this space, but that was a great occasion too, I'm sure.
Well, we had a good night out, and you might have heard the expression overnight success takes on average a decade. And when I worked at Intel, one of the CEOs, one of the CEOs that I most admired was Craig Bard, and a lot of time for Paul Otellini. But one of the Intel values was win and have fun. So I try and espouse that, and with colleagues like John Sheehan and others, that's something we often think about. But I mentioned this on a LinkedIn post. I was talking to Professor Jeffrey Braithwaite, who's probably, I think, the most influential health innovation academic in the Southern Hemisphere. And I was saying, hey, Jeffrey, I'm going to an award ceremony the following night. And he said, look, if you win, just say yes and thank you, because a lot of the work we do is like working in treacle. So I just want to mention this book co-authored by Professor Jeffrey Braithwaite from Australia. He's the president of ISCA and the founder of the Australian Institute or Health Innovation. It's called Implementation Science and the Key Concepts, and it's all about how do you um, take innovations and get them adopted at scale in health systems. And it's really important because, Keir Starmer and others in the UK have been talking about institutional inertia. How do you get around this despite the willingness of clinicians and other people to innovate? It's just really difficult to innovate in healthcare. And this implementation science is very important. And we have a great talker, our speaker next week, Caroline Steele Gray, is professor of implementation science in Canada, and she'll be speaking about the best practices. So this body of work is building, but I can't recommend this book highly enough. I was with a team um, at the awards, and we were delighted. We picked up three awards. The best healthcare innovation, the best overall digital transformation innovation. I was lucky enough to get the digital leader of the award, but we had some entrepreneurs. And just to do another book promotion, this is something I wrote a number of years ago with Pierre from Mike. It's called The Experimental Nature of New Venture Creation. Well, what we're seeing, as I mentioned earlier from Eric Van Hippel, the democratization of healthcare. So at the table, for example, was Karen Kelly. She's a brilliant nurse who has her own company, HeartPath, and she is doing advanced cardiovascular screening and really doing life-saving work. We had David Toohey, who's the CEO of Syncrified. They're a Galway-based company doing vital signs, automation. This is a technology that is used at the bedside. It's another 10x technology. And what David observed is the early warning score, which is used as a predictor and for directly driving the treatment of patients. In 50% of cases, this was wrong because nurses were computing these numbers in their head and they were under a lot of pressure. So he came up with a device called Q300 that automatically collects all this data, computes the early warning score. So we're now at zero errors on the early warning score. Well, what it does is the nurse, it frees up about a minute and a half per up cycle so the nurse can go back to nursing. And I was having a discussion. I attended a brilliant talk last night by Dr. Jimmy Sheehan, who is one of the giants of Irish healthcare, but Dr. Phil Hay, who is the president of the big nursing union, the INMO. And we were talking about this, about automation and the ability to free up time for the nurses to do nursing and actually, interact with the patient. So this is kind of a long answer, but we had a patient at the table, Gary Boyle, who's a VP of Parkinson's. He's a brilliant advocate for the use of digital technology and for patient empowerment. So we had a lovely night. It was great to be joined by leaders and Professor Vera Keatings, who we worked with to put an amazing innovation into, Donegal, where remote patients with another great nurse, Antoinette Doherty, and we've kept, very sick patients with severe COPD at home, avoiding all sorts of hospitalization. So I think it's fantastic to do the work. And then, when you get a result, it's nice to get the recognition and really important to celebrate it as well.
Well, congratulations. Well deserved. And before I do wrap up, is there any parting thoughts you'd like to leave our international audience with? Could be anything maybe that we haven't touched on or something that we have touched on that you'd like to expand upon, but just some parting thoughts from you, Martin.
Well, first, Simon, thank you for the invitation today. And you're just prolific. And I've listened already to a couple of the Vista talks, and they're wonderful. But I would say just two thoughts. We actually can fix healthcare globally. We can't depend on governments and various departments of health because they're not actually designed for radical change. They're designed for incremental change and stability, and that's important. So we have to do something different. And I would encourage people to be using the language, stay left, shift left, 10x, and talk to your politicians, talk to your health leaders that this is where we should be going. But really important from an individual health standpoint, please take responsibility for your own health. Our parents' generation, it was always the doctor knows best. In the future, it's about co-production. It's about the patient and the person and the clinician taking co-responsibility for their health and proactively managing it. And if we think about the social determinants of health, only 10% of our health is dictated by healthcare and clinical care. And that's where we're putting all the money. In Europe, we're spending 97% on illness restoration, just 3% on wellness. But for us as individuals, 40% of our health is determined by nutrition and exercise and other things like that. 30% is our genes, and that's kind of the look of the draw. Environmental conditions are really important, but the biggest part of our health outcomes are driven by our own behaviors and what we eat, how much we exercise. And we just completed, an early phase proof of concept with one of the Irish health insurers, Irish Life and Carillon Global Solutions. And we did a proactive health check. We put in a wellness program. And some of the results are staggering. One particular person, for example, VO2 max is probably the best measure of individual health, but it's also the best predictor of longevity. And this particular individual committed to a program where they walked 10,000 steps for 6 weeks. They complained about it, but they did it. But their VO2 max doubled in 6 weeks from low 20s to low 40s. That's absolutely phenomenal. So they've doubled their cardiovascular fitness, but the impact on their life expectancy is huge. So that simple action, a 6 week intervention, can have dramatic impacts on our longevity. So I think the message is for everybody. It's no longer doctor knows best, it's patient knows best with clinical help and AI help, but own your own health. And you can have a happier, longer, more fulfilling life if you do that. So stay left, shift left, 10x. And thank you so much, Simon. Guru Market.
Well, thank you so much. It's been a real pleasure and a privilege to catch up with you again today, Martin. Thanks very much indeed for being a guest here today on Vista Talks. All that remains me to thank everybody who's been watching or listening to this episode around the world, and to invite them back to catch up with another Vista Talks episode where once again we'll be talking to some interesting people and having some interesting discussions about global topics. Thank you so much indeed, Martin. It's been a real pleasure to talk to you again today.
Thank you. All the best, Simon.